Good afternoon. I'm Sean Yao, and this is One News Now. The government is planning to vaccinate more healthcare workers with one dose in order to provide them with partial protection at the very least. To give us her insights on this, Dr. Maria Consorcia Quizon of the National Immunization Technical Advisory Group, or NITAG, joins us on the line. Good afternoon, Dr. Quizon. First off, what would happen when a person does not get the second dose, or if the second dose was administered beyond the recommended time period? Would this really, lower the chances or efficacy rates further?
Well, first question first. No, there has to be two doses, at least for the AstraZeneca vaccine and the Sinovac that we have already. Okay, such that the first time we allocated, we saw to it that two doses are secured for each person. Now, what happens when we don't want to think that the second dose will not be available on the recommended time that it should be given, referring to the second dose. Now, what they are telling us now is that there could be an assurance of an incoming supply. For example, if a next supply of Astra is coming, then certainly we can use the first, all of the first supply that came in, because we know with assurance, again, I will say with assurance, that in fact within the 4 to 12 weeks, which is the recommended interval for AstraZeneca vaccine, if in fact they come, then first in, first out, sure, why not? We can use already what is here on hand with us, considering the surge, and we need really to protect our health workers.
All right, because this is not the first time this has been suggested. Maybe first time here in the Philippines, but we've heard of it being done in other countries in the West. They said, basically that any protection is better than none at all, and they would just rather spread this. You're also saying if vaccine supply is secure, do you have any reason to doubt that this supply forthcoming will
yes,
really?
We do have reason to doubt, because we have been burned twice. First time they said that Pfizer was coming, and then they said Astra was coming the very next day after Sinovac, and you know that didn't happen, right? I mean, there are so many factors in play globally, such that personally for me, I think it's beyond anybody's pay grade in our country to really make sure which is coming, when it is coming. So this time, they're telling us that for sure, within the next few weeks or 1 to 2 months, a fresh tranche of AstraZeneca vaccine will come. And if, in fact, that is going to be that's secure, we're 100% that's sure, then why not? We can start vaccinating. It's the other countries' prerogative if they want to risk, that the second vaccine may not be ready within the prescribed time. Not ready, but I mean available within the prescribed time that the second dose should be given. That's them. They probably know that they will, more are coming. But as far as the Philippines is concerned, we want to make sure. Otherwise, we would have negated the gains that we got from the first dose. If the second dose is not given within the prescribed time, then we go back to square one. So it means that you're trying to do more, but in the end, you may not have. You may have to repeat, and vaccines are so scarce. We can't risk that. I guess that the first dose given to so many people will be negated because the second dose didn't come on time.
All right, thank you so much, Dr. Quezon, for being so candid. I just want to ask also if we're already seeing results from international studies on mixing two brands of shots or administering two jabs from different pharmaceutical companies. What are your thoughts on this?
As of the moment, the recommendation really is to give the same kind of vaccine. We don't mix.
All right, loud and clear. So it's just like, sometimes when they say don't mix, they really mean don't mix. Now, Dr. Quezon, what can you say about the current pace of our nationwide COVID vaccine rollout? Can we expect this to accelerate anytime soon?
Well, hopefully, because in the first place, no, we have about 1 million plus doses, the Sinovac and the Astra together, and based on the report of the Department of Health, more than 90% of these vaccines have already reached their destination. However, as of yesterday, I think less than 40% have actually been injected. But we have so many success stories because many hospitals, both private and government, are saying, there, we did it. We vaccinated 100% of our staff. So the vaccine is there. It's available. They reached already the places where they're supposed to reach. Now, it's in the ball is in the court of the receiving hospitals, how soon and how fast they can jab this vaccine.
All right, so you're right, absolutely. Yesterday we were reporting, I think around 96% of vaccines have been rolled out already. So pending the administration of those jabs, Dr. Quezon, what now happens to this limbo or this lag between now and when we get the next shipments? I mean, could this be, problematic for us because it's not continuous in terms of vaccine rollouts?
Well, the good news is the fact that we already have it's like we did a dry run, right? I mean, we've rolled out, and people at the grassroots have started vaccinating the healthcare workers. So it just means that the system is in place. Now, when the next tranche is gonna come, as I said, is anybody's guess. There are scheduled. They have schedules, but we don't know. So I'm just saying that it's not going to be harmful. We do want to imagine that they're going to come on time. But if they don't, we are prepared. At least we have a dry run, and we know that the next would. The startup is always the hardest, right? So we've started, and when the next tranche comes, then we're ready, and hopefully it's really going to go faster.
All right, thank you so much for your time and for those clarifications. Dr. Maria Consorcia Quezon, a member of NITAG. Let's check in on other vaccine stories from around the world. Moderna has started its mid to late stage study of its COVID-19 vaccine for children aged 12 and below. The study intends to assess the shot's efficacy on 6,750 children across the U.S. and Canada. South Africa has approved Pfizer and BioNTech's vaccine for emergency use. This approval is still subject to further surveillance, including the monitoring of its efficacy rate against the local COVID variant. And in the United States, the Centers for Disease Control and Prevention says employers with a large workforce may set up temporary vaccine clinics. The CDC says this will help employers prepare for inoculation once COVID-19 shots become available for the general public. And in other news, health experts are looking at improving the regulation of vaporized nicotine products and e-cigarettes in the country. Mean Los Baños joins us live from Mandaluyong for more details. Hi, Mean. What measures were discussed during the Senate hearing today?
Hi, good afternoon, Sean. Several medical experts are actually pushing to increase the minimum age access to vapes and e-cigarettes to 25 years old from the current 21 years old. Citing previous studies, Philippine College of Physicians Executive Director Dr. Maria Encarnita Limpin said maturity is not reached until the age of 25. Limpin added that increasing the age limit will help prevent early addiction to vape and e-cigarettes. They said alternatives to regular e-cigarettes or cigarettes, according to Limpin, are also addicting because they still contain nicotine. But for Philippine Academy of Pediatric Pulmonologists President Dr. Regina Canonizado, the current age limit of 21 years old is just right. Canonizado said that 18-year-olds should not be allowed to buy heated tobacco products as they are still considered adolescents. They are also more prone to addiction as their brains are not fully matured yet. On the other hand, several vape advocates says it is okay to allow those who are already 18 years old to use them just like in other countries. They also believe there are already enough restrictions for them. Meanwhile, Sean, the Food and Drug Administration supports the proposal to ban the online selling of vapes and other heated tobacco products so they can conduct stricter regulatory oversight. Senator Pia Cayetano and some medical experts are also calling for the prohibition of any form of advertisement and any marketing strategies for vapes and e-cigars, as they believe would entice young people to smoke e-cigarettes. Sean, during the hearing, several health groups also agreed to proposal to put health warnings on vapes and e-cigarettes to make sure that the public is aware of its health risks. Sean?
Thank you for that update from Mandaluyong City. That was Mean Los Baños. And the agricultural sector of the Alliance of the Philippines, or AGAP, is questioning the Agriculture Department's move to increase pork and chicken imports. In an interview with One News's Agenda, AGAP President Nicanor Briones said that 900 million to 1 billion kilos of meat are already being imported every year. The group does not believe that DA Secretary William Dar was not aware of the so-called Tongpats scheme within the agency. Senator Ping Lacson earlier revealed that a supposed syndicate within the DA could receive as much as 6 billion pesos in kickbacks from the increased volume of imports.
Ito, matagal na namin pinagdududahan na bakit parang gustong-gusto ng Department of Agriculture na mag-import at palaki ng palaki kahit na may sapat na supply ng manok, nadagdagan na 62 million kilos last year. Ang baboy ay bagsak na, import pa rin sila.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.